Okay. Okay. It is right at 12 o'clock, so we'll go ahead and get started. I'm going to stop sharing my screen here. And okay, getting on my screen situated here. Okay, so welcome back to another Health Talk series. Today we're talking about breastfeeding, and I've got Dr. Porter here. Dr. Caitlin Porter is a provider at Baker Center in Linville. And fun fact, she was one of our residents that stayed with us. Ooh, and another fun fact, we started around the same time. So when you started out as a resident was around the same time that I started. So
I
we've
didn't
been
know
here.
that.
I know we've been here together, and I've watched you
Well,
be
I
a
feel like you
resident.
I feel like you know so much more than me. So you've been here a lot longer in my eyes.
No, 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 no. We've been here at the same time. So anyway, I'm super excited to have this talk with you. I know we have already talked on the phone before and we've had conversations about this topic, but and like we just kind of mentioned before, there's a lot of stigma around breastfeeding. And again, we've talked about this before, but we talked about how many years ago when formula came out, that formula was the right thing to do and the golden star thing to do. And you were supposed to do that. And then now times have kind of changed. And I think for our generation, we're being told, no, if you can breastfeed, please try and breastfeed. But then there's also stigma around that you have to breastfeed, or there's something wrong with you, or you did something bad if you didn't breastfeed. And there's so many mental health things that are combined into this topic. And like we were just saying before people started hopping on, that it's hard being a woman. So there's just a lot to cover here. So I am super excited for us to talk about this. And I'm going to let you introduce yourself, and I'm going to go ahead and start sharing my screen. So I'll let you take it away. And like I told you, I'll kind of chime in and I'll bounce in and ask you
Mhm.
questions as we go. But let's see. I'll go ahead and start sharing my screen here. Let's see. Share. Here we go. Okay. Okay, Dr. Porter, I'll let you take it away. Oops. Hold on one second. I can't hear you now. How did that happen? I just heard you a second ago.
Can you hear me?
I can hear you now. Maybe it's
Okay.
me. Maybe when I share the PowerPoint, it does something weird. So I might just leave it like this. I'm so sorry. I think when I share it,
Okay. That's totally fine. I mean, it's just words on the screen. We can talk about it. I
okay.
understand.
Okay, we're gonna
As long as
roll
you can
with
hear
it.
me, that's fine.
I can hear you now, but I think when I share my PowerPoint, I couldn't hear you.
That's fine. Yeah, we can work
Okay.
around it. That's no worries.
Okay. Okay. I'm
Yeah,
so
so
sorry.
I'm Caitlin Porter. I work out at Linville at the Baker Center. And recently, I had my son in June of last year, or July of last year, actually. He is a year old now. And we kind of went through a journey, and I'll tell you a little bit about that in a second. But breastfeeding became really important to me because, like we talked about, the stigma around it. I was a formula fed baby. I was born in that generation of, formula was, if you could do formula, you were important. You had the means to do that, and breastfeeding was the secondary choice. And now I think we've kind of transitioned to this breastfeeding as the first choice. And we'll get into why and why that should be, and that formula is a secondary choice. And I don't think that's true either. I don't think formula is the secondary choice. I don't think you're settling for formula. I think you
Right.
do what's best for your child and for your family. But I think the biggest thing for me was I went into it knowing I wanted to breastfeed, but it looked a lot different for me very quickly.
Hmm.
So my son was born in July at Watauga. He had a pretty hard time getting to be a normal kid the first couple days, and we got X-rays, we got CT scans, and realized he had a hernia in his diaphragm, and he had to be shipped to Brenner's. So he was shipped on day 2 of life, and I actually stayed in the hospital here for about 4 more days. And we didn't get any of that bonding. We didn't get skin to skin.
No.
He didn't know what I looked. But he started of breast milk that I sent with him, and that was kind of like, okay. he knows my milk. I've got to do this. And so I sat at Watauga and I learned to pump, and sent my dad to meet my mother-in-law on the and that just kind of became our thing. We continued to try to latch in the NICU, and it just never worked out. So pumping became our thing on his first birthday. And it really showed me, there's so many different ways to do it. And there's not a whole ton of support for those different ways, right? I still felt that, not negativity, but I guess that, the questioning of why aren't you nursing?
Yeah.
Why stuff. And so that's his first little picture of him getting milk in the NICU through his NG tube. I got to feed it to him. And then there he is now at his first birthday holding our last bag of pumped milk. And
were you excited or sad about that? Was it bittersweet?
I was pretty sad because of the way that it meant for us in the NICU, because of what it meant. I think I was pretty sad about that. But a little bit excited to hang that pump up, because it was, that sound was just, I was done with that sound. I was done with doing it, at all times being tied to the wall. But it was sad. It was definitely something that if you see the benefits of it, you really kind of get tangled up in. So that's kind of my why this is important to me. And of course he's my why for everything now at this point, but that's kind of what led me here.
I love that. Thank you for sharing that. And then I see here on your slide, I totally forgot to mention that it's Breastfeeding Awareness Month, and that was the whole point of doing this talk in August. I missed that at the beginning, so I'm glad that you put that on your slide. You've got me covered here, so we're good.
I got you. Yeah. So why does breastfeeding awareness matter? I think the first is to normalize all feeding journeys. We talk about breastfeeding, but there's so many ways to feed your child. And there's the Fed is Best campaign and the Breast is Best campaign. And really we want, and in that becomes healthy mamas. I want mothers that enjoy motherhood. And so normalizing all feeding journeys. And then of course, to provide judgment-free support. That includes, as physicians, support of how is best to feed your child. I've told a couple people, of course, and we'll get into it, of course, breast milk is good and kind of the best way to feed your baby if it's possible. If breastfeeding causes turmoil and stress and breaking apart in families and hardships and sickness, it becomes not the best way. And so that is part of this talk too. And then to educate families on the importance of breastfeeding with empathy for their hardships without guilt. And that goes back to, what I was saying, looking into if breastfeeding, is it something I can support you with and get over that aspect, or is it something that's not fixable? That formula becomes best. So
yeah. Now, are all of our primary care providers here, especially locally, do all providers share this perspective, or are there some providers out there that in essence force you or tell you? I mean, I don't know. Do you know what I'm saying?
I do. I don't think there's any forcing of either way. I think the difference would be lack of education and experience. I say sometimes I can't believe I told moms any advice before I had a child. I tried based on what the study showed, but I think just if you haven't experienced it, it's really hard to have that connection with your families. Not to say that you can't. I mean, if we all had to have experiences that our patients had to be able to treat them, we wouldn't have very many patients. But I think just education, just knowing, what is out there, what is normal, what is abnormal. And then, so yeah, I don't think there's a whole lot of education in medical school about it. It's kind of like, this is how you feed your baby. You should tell your patients to do that. And so we'll, again, talk about this in a minute, but I'm getting my IBCLC, which is my certification in lactation consulting. And that's just to get a little extra education around it and to be able to provide that service for families, because it's just not out there. You know,
Yeah.
you see your OBGYN until about 6 weeks, and then they can't see you anymore. I mean, because we have so many people having babies, they can't continue to see you. And so you go back to your family medicine doctor, and you kind of are in this like hem and haw period where when you don't have a provider, that's probably when you need one the most.
Yeah.
And so, yeah, I think it's just lack of education or importance, right? Where people feel, oh, that, you know, moms know best, which I agree with. But, you know, you just kind of leave it up to the mom to feed
Yeah.
their child, and then you kind of lose that support.
Yeah. Okay. Sorry, I didn't mean to interrupt. We're on to the next thing.
That I had to quell myself with some breastfeeding myths. I put a couple in here. You have to nurse in order to breastfeed. That is simply not true. You can, there are pumps, there are donor milk, there's all kinds of stuff. Baby pain is always normal. That is not true. It can be uncomfortable. Most of the time it is in the first couple days. Right. This is not something that you do very often. The baby has never ate. And if you're a first time mom, have never breastfed. And so putting baby to the breast or putting a pump to the breast can be really uncomfortable at first. But continued pain or excruciating pain is not normal. And so there is help out there. There is something to do out there. If you're nursing and it's uncomfortable, we need to work on latch. If you're pumping and it's uncomfortable, your flange size may be off. And so there's all kinds of things. So, you know, it's not a grin and bear it kind of thing.
Yeah.
Supply depends on how many lactation cookies you eat. That is not true, although they are very good.
Hey, I did not know this was a thing. This is a
Yeah,
thing. Lactation cookies. What is that?
lactation cookies. So I had a little like nesting party when Grady was coming, and one of my friends, fellow resident as well, made me a bunch of lactation cookies and put them in the freezer for me. They've got all kinds of stuff in them. They've got oatmeal, which is really people say, you know, is really good for supply. Chia seeds, flax seeds, all the good stuff, and then brewer for breast milk. If you look, you know, across all of the things. And while they're good, I mean, they're great for nutrition, right? That's a lot of good stuff.
Yeah.
And you're getting stuff in, you're eating.
Right.
And oatmeal makes you really thirsty to me. And so you drink a lot of water. And so it's definitely good. It's good to have a snack at 2 a.m. when you know you have to get up and feed or pump. And so those are great, but there's no good studies that prove that just eating lactation cookies is going to help you. It's really all about demand. And so with pumping, you've got to have a schedule. Your alarm's got to go off every 2 hours in the early days. With nursing, you've got to feed your baby on demand. You know, if your breasts are full of milk and it's not removed, it's going to signal to your brain, oh, she doesn't need that. And it's going to make less next time. If every time your breasts fill up with milk, you empty them, your brain's going to trigger, oh, she really needs this. We've got to make lots more. So it's really all about demand. And then, of course, supplementing that with eating right, drinking lots of water, which I think the lactation cookies help with.
Yeah.
And they're yummy. They really are.
Oh, I did not know that was a thing.
Yeah, they're cool. There's lots of different recipes. And then, of course, you have the people that will make them and sell them for lots of money, you know. You should not feed your baby milk if it is a different color. That is not true. We have a slide on that later. Milk comes in a variety of colors for a variety of different reasons. If you nurse, you usually don't see that because it goes straight into baby. But if you pump, you're going to have a rainbow in your fridge. You cannot maintain a good supply if you do not latch. That is not true. You can ask my deep freezer. It's not true. If you have the demand then you can keep up a supply. Some moms say if they latch, they get a better supply, and that can be true. Your latch can, or your supply can improve with latch. And so some moms will latch here and there for comfort or whatever. But honestly, I saw the same increase in my pumping with watching videos of my son, or pumping with my son playing on the floor with my husband. That oxytocin release. And then kind of like what we talked about before, the hardest one I think to talk about is formula is just as good these days. Formula is valid and 100%. I'm so thankful for formula, right? I mean, we mix formula with every one of my son's breast milk bottles because he needed that extra calories from being in the NICU. But we've got to stop just saying, just. If there's something we can fix, let's get this baby on breast milk. And so while that's a myth, I get that can be hard to hear sometimes. And I don't agree that it's not a valid choice, because it definitely is.
Yeah.
And then benefits. So for baby, it builds immunity. The nutrition changes with baby. So that early milk, that colostrum is really fatty. It's really good for growth. As we get older, as the baby gets older, it gets more proteins. Something I learned that was really cool when I was going through weaning is while you're weaning, the fat last ditch. I know we're getting ready to be done with this. Here's a bunch of nutrients for you. So it's pretty cool. It supports brain and gut development, and then it's actually been proven to reduce risk of infections, asthma, and obesity in children.
And that's something I've heard before too, of when you breastfeed, you also give your baby autoimmune things as well. So that goes into reducing the risk of infection.
Yeah. So it will change. I could tell because I pumped, so I could see it. I could tell when one of us in the house were getting sick, even before we had snotty noses, because the milk would be blue. We'll talk about that in a minute. It would change. It would increase antibodies. And that's another myth that I didn't put in there, but you hear you can't do that if you're not nursing, right? Because you have the baby latches and you get the exchange of antibodies and things like that. While that happens, it can happen from kissing your baby on the head too. So I just had to kiss Grady a little extra. And so, you get realizing somebody's sick, it's going to produce antibodies.
Really cool. The human body is so amazing.
It's pretty amazing to be a part of, that's for sure. And then for mom, there's lots of benefits. So in the early days, uterus recovery, you'll hear, if you've had a baby in the hospital, you hear somebody come by and say, when you nurse, does your belly hurt? And that's because we're asking if, when you're nursing, is your uterus contracting back? And your body releases hormones to contract your uterus. So in the early days, it's really good for uterus recovery. Over time, there's a reduced risk of breast and ovarian cancer in the mom. Of course, that calorie burn, sometimes that's counteracted because you're starving. And so you don't get much weight loss because you're hungry all the time. But there is a good calorie burn. And then, of course, that bonding and the oxytocin. As stressful, it's some really good time with baby.
Yeah.
So here's the breast milk rainbow. Like I said, if you're nursing, you're probably not going to see much of this, right? It's going directly into baby, which is what I tell people when they're talking about pumping. They say it's this weird color. Should I give it to them? If you're nursing, you'd never know. The baby's just going to get it.
Yeah.
So that early colostrum, that first couple pumps, is very yellow. That's because it's got a lot of that fat content in it. It's that hind milk. Clear or bluish can be foremilk or antibodies. If it's really, really hot outside, if you're pumping in the hottest part of the summer, usually it'll be pretty blue because it's more fluid. Maybe.
That is just the coolest thing I've ever heard. That made my week.
It changed milk that we're still using, and going through it, you can see the colors, and I write little notes to myself on them, like with my husband, like just what we did, so I know kind of where that milk, what we were doing when I pumped that milk. And if it's hot outside, that milk will be bluer. It's pretty cool.
Wild.
Yeah, it can be brown from what's called rust the ducks, and just kind of stays there. And maybe something you want to ask your doctor about if you're seeing that, because you want to, make sure what is bleeding. But sometimes, most of the time, it's just trauma from nursing. Pink and green a little bit later on in the slide is natural coloring from the food. You can eat a whole lot of green stuff, a whole lot of pink stuff, and your milk will actually be pink, green, all kinds of colors. Red means blood is present. They call it strawberry milk. And that's usually trauma at the nipple from, either being to someone about, because you want to get it fixed because it's painful. It's not dangerous to feed the baby, but it can be painful. The other thing to tell patients during that time is sometimes that blood is not easily digested, so you'll see it in the diaper, and it can really scare them. The baby's diaper, but it's coming from breast milk, so just something to watch. And then white is that transitional kind of normal milk. If you think about breast milk, it's
Right.
Yeah.
Wow. I think that is so cool.
So kind of the more boring slide, what's in breast milk? Of course, 50% fats in the breast milk. You have carbohydrates, whereas we get our carbs from like glucose, things like that. Babies get lactose, and this is going to support their gut health. Vitamins and minerals that are customized to baby. Immune factors like IgA is usually the immune factor that's released through breast milk and white blood cells. Hormones and enzymes that support digestion. Even stem cells, which I thought was pretty cool. And then it constantly changes with age, illness, and even time of day. So you'll hear a lot of moms that pump and they keep their milk from the night separate from the day, because it can affect baby, because during the night it has melatonin sleep factors in it. And during the day it doesn't. A lot of pumping moms mix it all in one big thing and just feed it to baby throughout the day. That's what I did. But there are.
I just lost you a little bit on that last sentence, and it may have just been me, but if you don't mind to repeat that last sentence.
Yeah. So all I said was that, like, during the night you have breast milk that releases things to help baby sleep, and during the day keep them awake. That was all.
That is really cool. It's just really fascinating me. I did not know a lot of this information.
Right. You really don't until you're in it. You just don't. And I know we talked about this earlier, but ways to breastfeed: nursing at the breast, pumping, combo feeding. And when I say combo feeding, that is any combination. So breast milk, nursing and pumping, or nursing, pumping, and formula. That's called triple feeding. And that is almost impossible to continue and not sustainable. If you are doing that, please talk to someone, because that's really, really, really hard. And we need to find a solution so where you can sleep. Bottle or cup feeding, you can, that's with pumping. You can put it in a bottle. Donor milk, there are plenty of moms out there that just don't have the supply that, search out and buy breast milk for their baby. And then supplemental nursing systems. And I like to tell people, if you give breast milk to your baby, you are breastfeeding. If you give breast milk to your baby for 2 minutes, 2 hours, 2 months, 2 years, you have breastfed. I had some friends in the NICU that gave colostrum to their baby and then couldn't anymore because they were in the NICU, and NICU life's a little bit different. They breastfed. Their baby got colostrum and they got all of the things that they needed. The longer the better, of course, if it's sustainable. So, I encourage people, we celebrate in this office any amount of breastfeeding, because it is hard. If you did it sitting in the hospital and that's all you breastfed, then you breastfed and you deserve to be celebrated. Because
yes.
It is different.
I love that. Celebrating all women.
Yes. Yep. And then safe storage of breast milk. This doesn't matter for nursing moms, but for pumping moms, it's so It's a lot. I literally printed this out and just put it on my fridge.
Yeah.
So breast milk can stay at room temperature for up to 4 hours. So that's straight pumped from the breast, in the refrigerator for up to 4 days, in the freezer for up to 6 months, or deep freezer for a year. And then once it's thawed, you can keep it in the fridge for 24 hours. Once you warm it up, no matter if it comes from the fridge or the freezer, you should use it within 2 hours. And you never refreeze thawed milk. The thing I do like about it is you can refreeze breast milk until the last crystal thaws. So if you squeeze that bag and there is a ice crystal in it, you can stick it back in the freezer. But if it's all thawed, if it's all liquid, then you can't refreeze it. So you have to use it either for, and we'll get into this, either for feeding or milk baths or other things we'll talk about.
So I'm sorry, I'm sitting here thinking, I'm trying to do math. When you were breastfeeding, were you breastfeeding during the hurricane, when the hurricane hit here?
Yeah. Yeah.
So what about all the mamas out there that lost power for weeks? They lost all this breast milk?
All their breast milk. Yeah. I do have a video that one of my friends sent me, somewhere maybe in McDowell County, I don't remember, but it was a couple guys that were carrying a deep freezer across a creek because it had all the breast milk in it. So luckily we did not lose power very long. Deep freezers usually are pretty good for about 24 hours if you don't open them. Now with our fridge, with all the milk in there, we just had to transfer to a cooler and keep doing ice. And we had a generator, and I was like, we're not using it for anything other than any milk products. And so, yeah, a lot of moms lost milk, which is really hard. My mom volunteered at a shelter in McDowell County, and she had some breastfeeding moms that would show up with their bags, and they had to use it. You have so long to use it, so that is really hard. And this is in a later slide in resources for parents, but we'll talk about it now. For moms that are pumping, so they're storing all of their milk, there's a great resource on Facebook called Exclusively Pumping Mamas, and it's a Facebook group, and that they have articles, and they have an article for natural disasters, and what to do. Like, here, we're having a natural disaster, you have a bunch of milk in your freezer, here's what to do. And that was really helpful to kind of read through and see, okay, am I doing everything I need to do to kind of protect it, to keep it? But it can be really stressful, and something I think we should acknowledge with our pumping moms is that supply is their whole life. That stash is like everything. You can even get into Facebook groups where you're comparing and making sure, and so, yeah, a lot of moms lost a lot of things. To that, I will say there's a slogan that I like to use that says, feed the baby, not the freezer. So, if you lose your stash, if you're still pumping, especially, you can pump that fresh milk and give it to baby. And because you're giving milk to baby. If you lost your stash, and we rebuild,
Yeah.
And so, but yeah, that was a really hard time for a lot of moms, and formula went scarce. And if the baby's under 6 months old, I mean, it's breast milk or formula.
Yeah.
That's kind of, and so really hard time, but the community came together. I saw a lot of people offering breast milk, in some of the groups I was in, which is totally reasonable to do. Especially if you trust the person and you know them to use donor milk. So
Yeah. Wow.
Yeah. Something you don't think about.
No, I know. And I'm sitting here, I don't know why it crossed my mind. And I thought about, well, wait a minute. Because I was thinking it would be terrible, like if you lost power and you lost all of that. And then I thought, well, a lot of us just lost power for many weeks, So,
Yeah.
wow.
Yeah. Hard stuff. But in that vein, you have milk that's gone past the date, or it's not safe to give baby. There are other uses. Milk baths are wonderful. I prescribe them all the time if the mom is still pumping or has some pumped breast milk in the fridge. It is truly, I'm not going to say a cure-all because there's not those, but it can help. My baby, as soon as he gets anywhere close to a diaper rash, he's going in a milk bath. And milk baths are pretty easy. You put them in the bathtub, and I like to use a smaller container if you have a toddler bath or a bucket or something, just because you don't have to use as much milk. The bath is totally fine, but you don't have to use as much milk if it's smaller. And you put enough milk in there to make the water cloudy.
Okay.
And then you play. You play for 30 minutes. And you just play in the water. They'll come out a little sticky. You'll have to wash the bath out because it'll be a little sticky, but don't clean them off. Just let them be. And most of the time that rash is going to be gone the next day. And it is awesome.
That is so cool. Again, I didn't know this.
Yeah, it's great. And so we do that a lot. We do some milk salves. There's all kinds of recipes online that you can make and make like lotion. I mix it with like Desitin all the time, or just eczema lotion. Just mix it with lotion and smother it all over them. And then something I recently learned about, there are several companies actually that make milk jewelry. And so you can send them like an ounce or two of breast milk, and they turn it into a stone, and you can have it on a necklace or a ring or something like that. So I think that's a beautiful way to preserve your journey, especially if it meant a lot to you. And so that's just something I put in there because I thought it was cool.
I think that's cool too. And I actually have seen that. I've seen that on like Etsy and stuff. So yeah, you're right. There's a lot of places out there that will do that. So that's
A
cool.
lot of places. Yeah, super cute.
Yeah.
So then what we were talking about, these support groups, local online groups that exclusively Pumping Mamas is on Facebook. They're great. The admins of the group are all very educated on pumping. It's a great place. They try to keep away from comparing, which I really like. They try to keep those my stash is bigger than your stash posts away, which is really good. And it's really a supportive group that I learned a lot from through my pumping journey, because I had no idea. And then of course, La Leche League is a national group. They have a local group as well that you can join and meet people through. Some helpful apps. The Pump Log or Dairy Bar is a way to document milk. This is for pumping, to keep up with your stash. There's a calculator on both of these apps that you can put in to see how long you have to pump to make it to a year or whatever. If you want to feed your baby for a year, do I have to pump for that full year, or am I storing enough to quit early? So those are really good to kind of keep up with stash, which I would recommend. Nara Baby is a really good app that I used. They've got a really good breastfeeding portion to it, or nursing portion to it, where you can time what side of the breast. You're not going to remember what side you started on at 2 a.m. You're just not. So put it in your app.
Yeah.
You don't remember anything really at 2 a.m. So, and then Mommy Meds is a really good app. You have to pay for that one. But the free one is LactMed, and that is to look at prescriptions or over-the-counter medicines to see if they're safe in breast milk.
Oh, okay.
Really important, because a lot of people don't know. And so I use LactMed when I'm talking to my patients. I recommend Mommy Meds. And that's just, it's really good for over-the-counter stuff. I am sick. I want Mucinex. How's this going to affect my baby?
Mm-hmm.
It's also really good to double check when you get prescribed something, when you get prescribed SSRIs for the anxiety that might come with postpartum or anything like that, to just check against it and see how safe this is for baby. And then professional support. Ask your primary care provider if they're uncomfortable or they just don't have, the information. I'm happy to see patients just for this, and they still, stick with their primary care provider. But ask. It doesn't hurt to ask. And it's part of our healthcare. It's part of our baby's healthcare. So it's definitely reasonable to have a visit for.
Yeah.
And so final slide, you've got this. Breastfeeding is natural, but it is not easy. The worst thing I think I've heard is, oh, it's natural, you'll figure it out. You might, but there's no reason for it to be horrible. It should be beautiful. And if you need support to make it beautiful, get it. Every journey is valid. It does not matter how you feed your baby if it is safe for you and your baby. I can't stress that enough. But if we can make breastfeeding happen, let's make it happen. There's no wrong way to love your baby. And our idea is to give support, not pressure. So I tell my patients, how do you want to feed your baby? I want to spread them out. And then I will leave you with, you can cry all you want over spilled milk, especially at 2 a.m. I have done that several times. You will most certainly knock over a container of milk. Your baby will waste a bottle, and you'll cry about it because it is literally liquid gold. So
Yeah.
it is totally okay to do that.
Well, all well said, all great points. I'll leave this screen up here just a little bit in case people want to grab some of these resources. But okay, Dr. Porter, I've got a few questions for you. We had some people submit questions ahead of time before the health talk, and then after I stop sharing my screen, I'll also be able to see the chat. So if anyone on the call has any questions, please feel free to put those in the chat. But I'm gonna just go ahead and kind of start us off with some questions. This was a question submitted. What if I actually feel touched out, anxious, or even resentful every time my baby wants to nurse or breastfeed?
I've had this question, and I felt this question. You can feel very touched out. You are needed sometimes 24/7, especially when that baby is cluster feeding, which means a cluster feeding just means they're feeding in a cluster. They just want to feed every 5 minutes, every 10 minutes. I think this starts to get near that line of, do we need to do something different?
Yeah.
Because if you start feeling resentful to your baby, common, not normal, right? So very common. You should not be ashamed of that. You should tell somebody about that, but it's common. And is that going to put you or your baby in danger, right? You hear about things that happen in that postpartum period that would never happen to somebody in the normal state, right? And I had somebody tell me one time, there's a reason they use sleep deprivation in torture. It messes with you. And so when you are sleep deprived and you are touched down and you don't want to do anything else, is it going to be safer for you to pump and give that breast milk to the baby, someone else give it to them? Or is pumping going to set you off and you need to do a formula bottle? And that is okay. That is totally fine. You're not going to miss it. Formula doesn't detract from the benefits of breastfeeding. If you're giving one bottle of formula and the rest are breast milk, you're getting all of that. And then, so I think my answer to that would be, if you are this side of that line, I would hug somebody you trust. I would tell somebody you trust. I would watch your favorite movie and I would sit down and nurse the baby, if that's what you still want to do.
Yeah.
But if you're like, no, I need to do what I need to do for my family and my baby, and I'm going to be okay with this decision, then I would pull back. I would give a formula bottle and I would go to bed.
Yeah.
Yes. And that's, your partner wants to help. Usually, my husband was so excited when we switched to pumping, where he's like, oh my goodness, I get to feed bottles.
Yeah.
And so and all it took was 4 hours. When I felt like I was crazy, 4 hours of sleep, I woke up and I was a new person.
Yeah.
And so I think when you're feeling touched out, you need to not be touched. You need to go into your room and go to sleep or scroll or whatever. And formula is perfect for that.
Yeah. Okay, we got a few questions here in the chat. Someone said, are there any vitamins or supplements you can take to support breast milk production? And you talked a little bit about the lactation cookies and stuff, but are there any other vitamins or
There
supplements you
are
recommend?
there are marketed ones. There are lots of lactation gummies and all of this stuff. And most of them, if you get down to it, are like your normal vitamins and minerals. They're like your, magnesium and calcium and that kind of stuff. And that is great. Again, not perfect and evidence-based that they're going to increase, but most of them do. It's, again, increasing your supply is all about demand. If you are nursing and you're not pumping at all, then cluster feed for a little bit, latch baby on whenever you feel like they could use a latch. If you're pumping, there are scheduled, they're called power pumps, and it's to mimic cluster feeding, and it's 20 minutes of pumping, 10 minutes of rest, 10 minutes of pumping, 10 minutes of rest, 10 minutes of pumping. So it's an hour, and it's to stimulate your brain to say, oh, baby's cluster feeding, gather the troops, we've got to make more milk. And that's a really good way to kind of increase supply. And then water. You've got to stay hydrated. That is one thing I've seen that I will see a decrease in. And you're going to be dehydrated. I mean, you're giving. And so I hate it that there's not like a magic pill, like, because that would be so good.
Wouldn't that be nice?
It would be so nice for so many things, but I think just keeping yourself healthy, if it makes you feel good and it's safe, do it, because your happiness and the demand of pumping is going to be what increases it.
Yeah. Okay, you got another question here. Are there any vitamins or supplements you should avoid to prevent breast milk from drying out?
In the same vein, there's probably lots of things out there that could dry your milk up, but and they tout it as get people to dry up their milk, right? So avoiding those, but avoiding dehydration, avoiding long periods without nursing or pumping.
Yeah. How long can you go? How long can you go without pumping?
I really want to go every 2 hours. Through the night and through the day. And so it's exhausting. You can then start like going 3, going 4. I think about 6 months, 4 to 6 months is kind of that. Let's try sleeping through the night and see what happens to our supply. And it usually takes about 3 to 4 days to see a dip in supply from that. So, if you sleep through the night one night, do not worry, please sleep through the night. I mean, but you're probably not going to see a dip in your supply from one time. But if you do it more consistently and you see a dip, I tell people, if you're okay with that dip, cool, sleep through the night. I mean, if you're already an oversupplier and you're like, why? How bad do you want that supply, right? If you are feeding your baby enough and you don't have any to put in the freezer, but you're sleeping all night, win to me. I mean, you're feeding the baby, not the freezer kind of thing.
Yeah.
But yeah, it's really all about, again, it's all about demand, which is frustrating. It's not an exciting answer to give. But yeah.
Well, awesome. Well, we're right at 12:45. So we don't have any other questions in the chat. So I think we can go ahead and close out. Thank you so much, Dr. Porter. I absolutely adore you, and I really appreciate all that you do and for being here today and talking about this.
Well, thank you. It's a passion of mine. And see me for this or find me in the community. I love talking about breastfeeding. So I would be happy to support you in any way that I can. If that is washing pump parts, I will come do that, because that is the worst part of all this.
Did you say washing it?
Yes. What you have to wash after every pump, you wash 1,000 pieces.
Yeah. Maybe you should invent one that's not 1,000 pieces.
Wouldn't that be great? I know. It's 2025. Why do we not have a self-cleaning pump?
I know, right? Okay, I'm going to share my screen really quick. This is information that you can use to contact Dr. Porter. Again, she's at Primary Care Center out in Linville. You can scan this QR code and it will take you to the Baker Center. This is the phone number for the Baker Center. If you have any additional questions or you want to sit down with Dr. Porter, and Dr. Porter, remind me, do you see pediatric patients as well? So could mama
I
and
do.
baby come in and both
Yep.
could be your patient?
Yep. I see both of them. Yeah.
Love that. Makes it easier,
And
doesn't
we
it?
can talk about something in any visit. It doesn't have to be your visit to talk about how you feed your baby, right? If I see your baby, then we'll talk
Yeah.
about how to feed your baby.
Yeah.
It's part of everyone's healthcare.
Yeah. I love that.
And if I see your husband, I'll tell them to wash all the pump parts. So you can bring the whole family.
Yes, I love that. That's great. That works out.
Right?
Well, thank you, Dr. Porter. I'm going to keep this screen up here for anyone that wants it, and we'll go ahead. I'll leave this up for a little bit, and then I'll go ahead and log us out. But thank you so much.
Thank you. It was so good to be here.
Bye.
Bye.
Okay, everyone. Thank you for joining us. We hope you tune in next month. Bye.